let's have a question. Sheldon, Garon.
First, thank you, and also saying I heartily agree with you. I've been a tremendous beneficiary of private philanthropy, being at a private university,
right.
Maybe even gotten rich in the process. So I certainly would be the last person to run down philanthropy. I think it's a wonderful institution for a lot of the reasons that you said, particularly in terms of building higher education,
Absolutely.
scientific advancement. When you go around the world and you talk to, my colleagues around the world, everyone is envious of our university structure, our scientific advances.
Right.
The problem, however, that I sensed in your talk is I wasn't quite sure who you were arguing against. The marketplace, to be sure, and I share your skepticism that the market can really do these things. Philanthropy is wonderful in that respect. But as David pointed out, there is government. And I wasn't quite sure why you posed everything in terms of an either or. One would see that in the real world there are significant partnerships between government social policy and philanthropic efforts. So I'd like to hear a little bit more about that. And then let me just raise a mundane point that I'm sure you've been asked several times before, but let's talk about infant mortality. So you've talked about philanthropy can come up with creative solutions, but as you said, we're 26th, I believe, in infant mortality, and probably if you looked at the 25 who are better than us, most of them probably have national health insurance.
Right.
A mundane point, but
Right.
maybe significant.
Right.
Yeah, maybe it doesn't take a rocket scientist like Godard
Right.
to figure all this out, but that maybe the welfare state actually does have a legitimacy, and that in partnership with philanthropy it does things. So those are my questions.
Thanks very much, Shel. The role of government is very important. We haven't talked about the role of government. I was talking about the role of government as a legislative force to insist on taxing or otherwise depriving philanthropy of its autonomy. And that was the generator of the discussion on government. The role of government as responsible under the Constitution to promote the general welfare, which is actually the line from the Constitution, is an important role, and that is a role that there's no reason it cannot be or shouldn't be shared with private enterprise. For all the reasons, some of the reasons we talked about, that is, government can certainly provide large amounts of funds, which the private sector can't. Foundations raise somewhere under $50 billion a year, just foundations. I'm not talking about the whole amount raised by individuals. And that is, I think I calculated 1/33 of the amount of money spent on social well-being issues in the country. So the 800-pound gorilla in the discussion is the government, and we're not going to replace that with private philanthropy like that. But a great deal of the innovation, as the current president's innovation fund indicated, does come from private enterprise, not from government programs. So there needs to be a partnership, and to a great extent, if we had more of us involved in creating more dynamic opportunities to address issues like infant mortality, it's something we haven't tried yet, and I guess I'd want to try it before I forked over the energy to a welfare state. The nurse-family partnership has been in place for 30 years. There are reams of evidence-based proof that it works as a way to stabilize infant mortality rates among the poor at the same level as middle-income families. But the Edna McConnell Clark Foundation has only so much money, so they fund additional places and they have to make sure that the ones they did stay strong. And what if, the private sector in philanthropy had an opportunity to enable them to really grow? Because we know where the poor are. We have a census that tells us the zip codes where the poor exist, so it's not as though we can't find them. And where those people are, That's where the infant mortality rates are bad. And we have a couple of programs with that kind of success. So I don't think it's either or, it's partnership, but it's a very, very important role for philanthropy.
There are also examples, aren't there, where you would have something that is born in a philanthropic, given birth by philanthropy,
Right.
that then proves to be successful and durable enough that it is then picked up by government.
Right.
It becomes, because it is able to build that broad political support, and,
Right.
and
Right,
so it's
exactly.
it's not either or. But what I'm hearing is that the philanthropic sector is kind of a laboratory for experimentation, innovation, and citizen-to-citizen giving,
Right.
that has a quality to it,
Right.
that you don't want to give up.
Right.
Right.
And also a changing of certain habits. I mean, a great deal of the difficulty that particularly very poor people experience is that they're not able to, they don't know how to handle certain things because they haven't been in a framework where they were able to learn that. And when that learning can go on over time, you actually get a change. There isn't an American program that I've been able to find that has halved the cases of blindness and amputation suffered by diabetics of extremely low income. And there's a foundation that developed a program with a former migrant worker at the head of it that has actually achieved those ends. That needs to be scaled up and scaled out. Could we afford community by community with community foundations and family foundations to actually do that nationwide? Maybe if we decided to. Maybe it would have to be part of a broader health program that the government funded. But to kill the energy and the innovation in American society by saying the government will do it would be an enormous fatality to our culture. And I share your impatience with the rate of change, particularly for the poor, as the rest of us live so well. So I think this is a very important moment where we say, we get it, and we're going to make a change because we think our culture is so important.